The number of people who went bankrupt last year because of medical debt in the United States was 643,000, according to government statistics. Britain, the number was 0. In France, the number was 0. In Japan, the number was 0. In Germany, the number was 0. In Canada, the number was 0. In the Netherlands, the number was 0. In Switzerland, the number was 0. And we could go on through all 33 of the 34 OECD countries. The number, Costa Rica, the number is 0. So, and then meanwhile, we've got a federal judge in Texas who says, oh no, Obamacare is unconstitutional. We got to strike that thing down. We need more medical debt. I don't get it. Dr. Michael Busler, as in PhD doctor, he's a public policy analyst, an economics expert, professor at finance at Stockton University in Atlantic City, and a columnist with Newsmax, LifeZine, and townhall.com is on the line with us. His website, muckrake.com/Michael-Busler, B-U-S-L-E-R. His Twitter handle is mbusler, B-U-S-L-E-R. Michael, welcome to the program.
Well, hi, Tom. How are you? It's my pleasure to be here.
Thank you. Thank you. It's good talking with you. So in this article that you wrote for, I've got Comdigan News. I'm not sure where else it might have been published or if this is a secondary source, but you write, the article is titled, if people want to Google it, Obamacare Unconstitutional, What's Next for U.S. Healthcare. And you make some good points in here in terms of solutions. I particularly like your idea we should have more doctors. The AMA's stranglehold on how many students can graduate from medical school that goes back to the 1940s is crazy. I agree with you on that. But you also note the ACA was just the Affordable Care Act, Obamacare, was just another more subtle way for the Obama administration to redistribute wealth. In this era when we have, just 15 years ago, the top 1% owned 33% of the wealth in this country, and the bottom 90% owned 33% of the wealth in this country. Right. Today, the top 1% own 40% of the wealth in this country. The bottom 90% own 23% of the wealth in this country. In other words, there's been a multi-trillion-dollar redistribution of wealth, 2 decades ago, over the last, basically since George Bush came into office, over the last 2 decades, from the working people to the very rich. What's wrong with redistributing wealth? If it means that people survive, if it means that you don't have 643,000 people going bankrupt, if you don't have, according to Harvard University, 40,000 people a year dying as a consequence of lack of access to medical services because of a lack of health insurance.
Wow. Okay, there's a whole lot there. First of all, with the increase in income inequality, which you're absolutely right, has occurred. But it's not a zero-sum game. It's not that the wealthy earned some and took it away from everybody else. It's that the economy has been so stagnant since the year 2005 and really since the year 2000. Once you have a slow growth economy, we haven't seen 3% annual growth. We'll see it this year, but we haven't seen it prior to this year since 2005. We haven't seen 4% annual growth since the year 2000, and that's when this income inequality issue became worse.
Well, it really became worse starting with Reagan's massive tax cut. Once he dropped the top tax rate below 50%, if you look at every country, all the developed countries around the world, whenever the top tax rate is above 50%, you have a middle class that actually grows faster than the very rich or the very poor. When it goes below 50% for people making over $3 million a year, you have a middle class that grows slower and a poor class that grows slower. In other words, they actually get poorer, and the rich get richer. I mean, this has been going on for 38 years, sir.
Yeah, so the solution is to take income away from people that have earned it and give it to people who, for whatever reason, haven't earned it.
Yes, that's what I'm asserting. I'm saying repeal the Reagan tax cuts, and let's go and rebuild the social safety net.
Yeah, I would do just the opposite to that. I would continue to keep the tax rates low, which will lead to better economic growth. That will lead to more opportunities.
No, that just leads to more billionaires.
It leads to more economic growth. And even though some people are doing extremely well, the economic growth will provide jobs for everybody. That's what's happening in the economy today.
You know, you're talking about wanting a 3% annual growth rate. I'm sure you realize that in the decade of the 1950s, the decade of the 1960s, and the decade of the 1970s, every single decade, you had annual growth rates that were 3% or above. Every one of those decades. And during the first two of those decades, you had a top marginal tax rate that was 91%, and during the third decade it was 73%. That growth rate did not collapse until Reagan dropped that top tax rate. But instead of arguing tax policy, let's get back to health care here. What I don't understand about guys who look at this the way you do is I'm guessing that it's fine with you that we all pay based on our income. Rich people pay more, poor people pay less. We all pay into local property taxes to pay for our fire departments. In case our house catches on fire, the fire department is going to come put it out. Rich people pay more, poor people pay less. I'm assuming you don't have a problem with that. Is your body not more important than your house? If your body metaphorically catches on fire, shouldn't we all be paying to fix that just like they do in the other 33 of the 34 richest countries in the world?
The answer is yes, we should, but we should do all that fairly. Look, the goal of health care policy should be to have the most reasonable cost, the highest quality care, and cover as many people as possible. Unfortunately, the Affordable Care Act missed on all three of those goals. Prior to the Affordable Care Act, where 85% of the population had health insurance, today, about 91% have health insurance. So the Affordable Care Act only helped about 6% of the population.
Well, if John Roberts hadn't knocked out Medicaid expansion, if the Supreme Court hadn't decided to play legislators from the bench, you'd have 100% right now, as you well know.
Probably, I agree. But the way it is now, we're not covering everybody. Healthcare costs are rising at a faster rate. Now, not this year, but prior to this year, they've been rising at a faster rate than they did before, and the policies that people get have such high deductibles that they're almost impossible to use.
Right, so let's not, we pay more than twice as much for health care in the United States than any other OECD country. And I'm not comparing all the countries in the world, just the 34 richest, 33 of which, all the way down to Costa Rica, provide comprehensive and essentially free health care to all their people. They do it in different ways. The British do it with socialized medicine, where they actually own the hospitals and employ the doctors. The Canadians do it as a single payer system. It's Medicare for all is what they call it, actually. It's called Medicare in Canada. What is so stupid about America that we can't look at what these other 33 countries are doing and say, we could save about 4 or 5% of GDP. We could save a mind-boggling amount of money if we simply did what Switzerland is doing with it's an entirely nonprofit system that isn't run by the government, what Canada is doing with Medicare for all, what England is doing with socialized medicine. All of them produce better results than the United States. We have infant and childhood mortality rates in Mississippi that are equivalent to some of the poorest countries in the world. I'm talking about Southeast Asia and Africa and South America.
Okay, so the whole U.S. system is based primarily on people taking individual responsibility and less social responsibility. Every country that you mentioned doesn't do that. They have a view for more social responsibility and less individual.
You're right, and there's also not a profit motive in any of those other countries.
There's also not a what?
The system is not based on the core of a profit motive. We have health insurance companies that are for-profit companies that are skimming 20% off the top just to pay their CEOs and their stockholders. And we've got hospitals. I mean, when I was back in the 70s, I was running businesses in Michigan. Michigan required both hospitals and health insurance companies to be not-for-profit corporations, sort of like Switzerland does right now. But Reagan blew that up with his brilliant conservative ideas.
But here's the problem with not-for-profit. When you're not-for-profit, costs are going to be much higher than they will be if you're for-profit. And the reason is very simple. If you're not for-profit, you're not concerned with what the cost should be.
Well, that's nonsense.
If you're for-profit,
I've run nonprofits. You do it as efficiently as you can, but you don't have to pay. You don't have to skim 20% off the top to pay your dividends to your stockholders.
Yeah. So if you are for-profit, there's more incentive to get things done efficiently.
No, there's more incentive to stash the money in the pockets of your CEO and your stockholders. What is the first legal obligation of a for-profit corporation?
To make a profit for the stockholders so they'll invest capital to improve the corporation.
Well, there's no so in there. There's no so in there. I mean, we just saw this with Donald Trump borrowing $1.5 trillion and the Republicans borrowing $1.5 trillion from you, me, and our grandchildren to give it as a tax break to billionaires and big corporations. And what did they do with that? Share buybacks. They put the money in their own damn pockets.
Okay, let me address that. The tax cut will not create that $1.5 trillion that's being put out there. As a matter of fact, in 2018, we've collected more tax revenue with the lower tax rates than we did in 2017.
Yeah, because the economy has been roaring, but wait until you go into a recession next year. That ain't going to happen.
That's the purpose of the tax cut, to get the economy growing so you do have a lower rate, but you're taxing a much higher base, so you bring in more revenue. So there is not
if we brought in more revenue last year, why do we have a $1 trillion deficit when Bill Clinton left office, there was actually a surplus?
Right.
In fact, when Barack Obama left office, there was only a $400 billion deficit. Why is it $1 trillion now?
Because the military has been decimated, and Congress decided we needed to spend $700 billion for the next couple of years to build the military.
That was a $34 billion increase. That's nothing close to $1 trillion.
$700 billion they're spending, and that's
right. And we spent $700 billion back in, or the equivalent, the inflation-adjusted equivalent, back when Clinton left. We only increase. Trump has only increased military spending by 38. We're out of time. I'm sorry, Dr. Michael Busler.
Thank you very much for a spirited discussion.
Yeah, I agree. Thank you very much for dropping by. M. Busler, Busler, is the Twitter handle. You can find his website at muckrake.com/Michael-Busler. Thank you, sir.